that start? What can be cut out in the beginning?
Yes, it's over there by Jared. Thank you everybody for coming. Lovely. Okay, so first off, we had our acupuncturist come and see us and talk to us leadership the other day. She is interested in meeting with anybody who's interested. The first visit, it's normally $70, and she's going to give everybody a certificate for it to be $42 for a one-time acupuncture treatment. If anybody's interested, I have a pamphlet here. She treats anything from allergies, back and neck pain, infertility, headaches. It just goes on and on and on about what she treats. So if anybody's interested, I have the pamphlets. Yes?
I was just going to add, in May we are celebrating Healthcare Week, and she emailed me about she might be offering, I don't know about acupuncture, but like free kind of like relaxation sessions, and probably doing a raffle for a free session. So if you're interested, maybe in May you might have a chance to win one. So I just literally learned that today. So
Awesome. Thanks, Anna. Everybody's seen that we have construction going on. So what the newest thing is that we're gonna actually have a water shut off again. That is not scheduled yet, but it's gonna be sometime soon, within the end of the week to the beginning of next week. They are refilling some of the holes that are in the parking lot and over by the ED entrance. And they are working on the old ED entrance as we're talking. So it's gonna be kind of noisy for the next, for however long. So, and then if anybody has any construction concerns, we need to make sure that we fill out, are we filling out the safety zones, or are we just letting Mandy, me, or you know?
You can either let us know, but if you do have a concern with anything that would involve safety, you can definitely fill out a safety zone and get it to us that way as well.
Yeah. Any questions about the construction? No? And then I was just asking about how huddles are going. Has everybody participated in them? Everybody?
Probably particularly the night shift or weekend crew. I don't know how huddles are going for you guys. If there's anything you want to see tweaked or changed, I know, that didn't sound like 7 p.m. was kind of working for everyone, so we kind of changed that to 2 p.m. and 8 p.m. every day to kind of keep it uniform. Does night shift or weekends have any thoughts or any concerns, or?
I have one.
Huh?
We don't really get any new information on the weekend, so we just did like one.
Sure.
Instead of repeating it Saturday and Sunday, and it doesn't make sense.
And that's probably accurate, because I do send it out at the end of the week, and then nothing gets added to it, so that's fair. And if that works for you, that's fine.
Okay.
As long as all of you are in agreement and the info's, you've already received it, that's fine.
Okay.
Yeah. And if you have anything new come up throughout the weekend, you can just throw it up on the board and make sure that we know. Sound good? Okay. I did want to let everybody know that we started an inpatient nurse council meetings. It is Andrew is chair, Kate is co-chair, and then we got Stacy, Ann, and Madison are all of our members. We've just kind of been looking at different things that we can be changing, any policies or procedures that we need to be changing. We did kind of look at our orientation packets that we kind of changed up a little bit. There are blood draw kits now that are in the Omnicell room. It should have all of our tubes that we need and the devices to change to draw all the blood and everything. We added the blunt tip needles. I don't know if everybody's had those or used those. We are talking about the stand desk for the charge nurses, being that they sit there quite often and quite some length of time. Dane and Jason are working on that. and if anybody has anything that they may want to change or look at or what have you, just let one of us know, and we'll bring it up to the nurse council meeting. And then the final thing that I have to talk about are the fire and tornado policies. So I know that like during the night shift or weekends, Jason will come and do like a fire drill. I know Jamie, you probably went through a couple of them. So he'll bring us out a sheet, and it'll say for the staff to like sign it if you guys know what is going on or what have you. And he just wants us to kind of go through and what we would do for a fire. So first off, you know, you would have to dial the pound 30 and then say, you know, attention, there's a fire, the location, and then make sure that we evacuate people through the fire doors, have somebody take the extinguisher, somebody needs to meet the fire department at one of the closest doors. And then for the thunderstorms, tornado watches, warnings, we just need to make sure that somebody is going to announce that. And then for us, all departments need to close all the blinds for a watch. And make sure that all the patients know that, yeah, it's just watch right now. If anything progresses, then we'll go ahead and update you. We need to get out the flashlights and the lanterns. And then if it's a warning, we need to make sure that all the patients have their blankets. We can put wheelchairs by their rooms if, you know, somebody's easy enough to get out of their room. If they're not able to get out of the room, then we need to do the blankets and we need to shut the doors. And we need to make sure that we wait for the all clear. Any questions on any of those? Okay. Now it's you.
All right, first thing I'm gonna be going over is the Pico dressings. I know this was kind of rolled out probably a few weeks, maybe a month ago. So this is like kind of a little handout that you are going to be given to patients. Dr. Kincaid will be doing a lot of these dressings probably going forward on his hips and knee ortho patients. A Pico dressing is kind of in the same vein as a wound vac in the fact that it does the negative pressure. However, if you do have like a deep wound, it's not going to be a substitute. You can't really pack anything in there. Essentially, kind of what it is it's just a kind of a smooth dressing that will have a little suction device set up to it. It's much smaller. It's about that size compared to, you know, your big wound vac canisters. And nothing really gets sucked into that device, the device itself. We'll never really need to remove a dressing unless it gets completely saturated. Then we might need to remove it. There is a little helpful diagram on the back of this page here that'll show you some bleed through drainage is normal, but if that dressing does get fully saturated, they will need to change it. The person at home should never need to change their dressing unless, again, it gets fully saturated. They should send them home with an extra. So if someone ever calls in, that is our answer, or when you're doing your discharge education, they should have already set up in outpatient a post-op, I think day 5 follow-up, where they will change the dressing or remove it for them anyway. You can shower with these on. You never want to get them directly wet, so no direct stream, and obviously never submerge them, but you can shower a patient with them on. Let's see. Does anyone have any questions about these? Okay, otherwise, there are diagrams on the back that show, you know, you should have that green light on at all times if the machine is doing okay. If you ever get an orange light, there are different reasons why, but again, it will kind of show it on these sheets. The patient should get one of these little tip sheets before surgery. Obviously, you kind of know how that goes. When you give someone something too soon, they might misplace it or forget about it. So we'll also be giving them out. Probably the charge nurses will be giving them out to any of those patients. And Randy and myself will kind of help remind them. For now, these sheets are in Randy's office.
are we gonna stop the dressings change?
We probably will not stock them on the unit. Outpatient will have them, and then when they bring over a patient, they'll give us extras.
And they're in the drawer by the charge nurse, not in my office.
Oh, okay. Good to know.
Yeah.
Does anyone have any other questions? All right. Well, that's all we really have that kind of pertains to techs or everyone. If you're a unit secretary, or not a nurse, I should say, you can feel free to leave. I know it's kind of short and sweet, but the rest of the meeting kind of just pertains to nurses only. You're welcome to stay if you'd like, but otherwise you're free to go. Thank you, everyone. All right. So I kind of met with Deb Varner talking about like our discharge process. One of the things that we have had in place but probably haven't been very good about following up on, and that's kind of my fault, I didn't really follow up on this, but we do have these action plans. Not every patient will receive one, but it's for patients with different chronic illnesses. Such as, I just gave the diabetes one as an example to everyone, but like diabetes, COPD, CHF, things like that. Patients will receive one of these or should receive one of these at discharge. And I'll kind of meet with some of the charge nurses. It's going to kind of be their job to hand these out to the patients. But what these are useful for is after we discharge patients, we are going to start doing discharge follow-up phone calls. We haven't decided whether Randy's going to take that over or the charge nurse, but it's going to be where we contact the patients probably about 72 hours after discharge, see how things are going, make sure they don't need anything. I know their follow-up, with their physician should kind of be around that time as well. But this will be handy for the patient because it kind of just color codes everything. So if you're in the green, you pretty much feel normal. But whoever's doing the follow-up phone calls, whether it's the charge nurse or Randy, will ask them to grab the sheet. Hopefully they haven't lost it or thrown it away. But then in the yellow, it kind of goes through some signs and symptoms, or for this, like what your blood glucose might be. The yellow, it kind of tells you the caution, what actions you need to take, whether you need to tweak anything. And then obviously if they're in the red, that's they need to take action immediately, probably head it right into the ED. So for example, with someone with diabetes, you can ask them kind of, have they been having any of the symptoms in the yellow or red, or what have their blood sugars kind of looked like lately? Does anyone have any questions regarding the action plans? Well, I don't think we're the only, we did these also at Mary Greeley, and I always struggled to remember to do these as well. So yeah, I don't think that's unique to us. We just kind of have to get in the habit of doing them, and then hopefully it'll kind of become second nature a little bit. The next, I know we reviewed this also in Huddle, but I just kind of wanted to reiterate this. Andrea said we might have had a couple questions on this, and this is just how I do it. I'm sure there's another way to get there in Epic. In Epic, there usually has multiple ways or multiple links to get to things. But if you click on your summary tab up at the top there that's highlighted, maybe not all of you might have, I think Randy didn't have the index tab or sub tab, but you can always wrench that in if you'd like. It has a bunch of different useful forms on there. But one of those is down there on the bottom right, you'll see the print section, and there is a post-mortem form. So I know a while back we kind of started to, every unit is trying to go away from having forms, just paper forms in drawers, just because those can get outdated pretty easily. So we've tried to go to all online. And one of those to get rid of them was the post-mortem form, just because it is already on Epic. It does look a little different. It is probably much more simplistic looking than what ours used to look like. But if you just go to that print, if you go to the summary index and then print post-mortem form, that's all you need to do. Does anyone have any questions over that? Like I said, you might know a different way of how to get there. That's just the way I know how to do it, so that's the way I included. All right, next item. So this kind of came up recently through the ED, and I know we don't work in the ED, but we do help out down there. So if you are someone who is documenting down there, if we have like a trauma or a code that comes in, the person might not have their wallet on them or identification or whatever. And if the person's unresponsive, you're obviously not going to know their identity, so you'd have to open up an anonymous chart or a John Doe, Jane Doe account. If we do happen to find out the patient's identity, midway through an emergent situation like that, the best thing to do is just continue on with that same chart, the Jane Doe or John Doe, the anonymous chart, and then afterwards we can have the unit secretaries kind of correct everything or fix everything, because that's going to be a little bit easier. It gets very confusing when you have that anonymous chart and then someone tries to open up a new event on the correct patient, because then there's two separate charts open for the same encounter and it gets pretty messy. I don't think that was any of our error, but it did happen in the ED recently. So just in case any of you were to, be that recorder and no one had created an event or a chart yet, just FYI, it is just a lot easier for everyone on the back end to fix it after it's all done, rather than trying to open two separate charts. And I know whoever did that, I know they were just trying to do the right thing, but just turns out it's easier for everyone on the back end doing it that way. Does anyone have any questions regarding that? All right. So the answering service hasn't been running very smoothly lately. If we do ever have any problems, don't hesitate to reach out to me. I'm not the point person to the answering service, so I never get to speak to them directly. So I kind of have to go through Brenda, through the clinics, the director of the clinic. She's the kind of the spokesperson for us, our contact person for the answering service. I know a lot of our problems kind of stem on the weekends, because that's when we usually get our, the most calls, or when the clinic is closed, I should say. So I kind of created this little flow sheet here. Obviously, like I said, kind of in one of my emails, I'm not going to be able to cover everything with a one-stop blanket statement, because you never know what a patient's going to call in for. But this hopefully helps cover some. So after hours, if a phone call comes in, I kind of want you to ask some initial questions. I gave some examples or guidelines. So you could ask the patient, what is your issue or question that you're calling in about? Are you a patient at Story County Medical? Is this regarding a recent appointment? Did the provider give you instructions if X, Y, and Z happened, if they did have a recent appointment? If it was a patient that was just seen in our ED recently and it's kind of anything related to that, then I would just automatically forward that call down to the ED nurse. They're going to need to either answer the questions over the phone for them, or just have them come back and kind of on hand help them with whatever issue they're experiencing. If they are not calling pertaining being seen in the ED recently, whether or not they've been seen at the clinic recently, there's going to be three options you're going to give most callers. First, that you can forward to the first nurse to assist with triage or any advisements. They can either come to the ED or they can follow up on the next business day with the clinic.
Is this like first nurse, like Greeley first nurse?
Yeah.
Okay.
Yep. Because I think giving them the options is probably going to be our best bet. That way they don't get frustrated or upset with us, if we automatically just forward them. And this has kind of been a process that we've kind of ironed out as we go, trial and error a little bit. Some things we won't use, like the on-call provider for, are like if someone's calling for a prescription refill, like it is what it is. Our clinic's not open. That's not our doctor's responsibility. The patient should have, filled that sooner. If they absolutely need it, unfortunately, they're going to have to go to an urgent care or an ED to try and get that filled or their issue resolved. And if they're calling with that, just any general, clinic questions, again, it's always their right to come into the ED if they want. Otherwise, they're just going to have to wait. We're not going to be, forwarding basic non-emergent clinic questions to an on-call provider. Above all else, like I said, I won't be able to give you a blanket statement. Just kind of use your nursing judgment. Some, might be a little bit of gray area. And in those situations, if you don't feel comfortable giving them a straightforward answer, you can always call the leader on call and get our feedback on what you might need to do. Or if it's something that you want us to handle ourselves, you can always give us the number and we can give them a call back, certainly. But you're always welcome to call us and kind of get some feedback on what maybe you should do. Does anyone have any questions? I know this is kind of, like I said, kind of a trial and error thing, and
Is there some, with the answering service and
Mhm.
first nurse, others, those two options on the weekends? It almost seems like they don't need the answering service, that they should just have first nurse.
yes, I agree. And that,
As an option. or
Sure.
call back for the next business day, just because it is kind of a gray area.
sure. And that's something, I will bring that up with Brenda. I haven't been really impressed with the answering service, and I kind of also wonder even why it's there. I mean, other than, it will weed out some very basic calls, like if someone calls in, with chest pain or something like that, they're automatically gonna say, you need to come into the ED, which again, the first nurse would do anyway, so. I will talk to Brenda about that, and kind of get her thoughts.
Or even if they needed a refill, first nurse would say, you need to go to the ER right now, or,
Sure.
you can wait until Monday to
Yeah.
go for that, because.
No, that's a good point. I will, talk to Brenda, and then I will, follow up with all the nurses, kind of let you guys know, send out an email, what kind of comes out of that conversation.
Also, the answering service still has Megan Myers as their point of contact.
Oh, terrific.
So maybe.
All right, good to know. I didn't know that. Thank you. Any other questions or suggestions or concerns about that? No? All right. So I kind of already touched on our last subject a little bit, kind of with the action plans. But the discharge callback, all that is like I said, we are going to try and get a plan in place for either Randy or the charge nurse to follow up with patients. It's kind of just something we're focusing on for quality, is following up with those patients post-discharge, kind of for a multitude of reasons. It is beneficial for the patient. We are trying to cut down on, readmissions, as well as hopefully it will kind of help with our quality surveys. I don't think there's any real solution to get people to turn in their surveys. If I was a patient, I'm probably one that's not going to want to take the time to fill out one of those big questionnaires and return it to the hospital. But hopefully that will help out a little bit with kind of motivating some of our patient population and returning those to us. I guess to end the meeting, I know not very long, so I bet a lot of you are bummed about that. Kind of open floor. Does anyone have any questions, concerns, anything they want to talk about, anything they'd like to see change, anything that might not be going well in the unit? Alrighty, well that's kind of all I've got, so thank you all for attending, I appreciate it, and enjoy the rest of your day. And if you forgot to clock in for the meeting, just send me an email and I can get that added on for you. There's always some people, so. Thank you.